Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale, Paradise Valley area for over 22 years, and this is all I do. All I do is cosmetic or aesthetic surgery. Of the surgeries that I do, facial surgery is a huge percentage of what I do, and it's really one amongst my favorite. People come from really all over the country and the world for me, and I feel very lucky that they come in and trust me to do that. A very common question that I get is, how long will my facelift or neck lift last? And the first thing to understand, what's the difference between a facelift and a neck lift? A facelift is a procedure that really addresses the face below the eyes, including the neck. A neck lift is generally a procedure that just addresses the neck, so the cheek area is generally not addressed with a neck lift. So who's a candidate of one versus the other? Most people that come in are not candidates only for a neck lift because they have laxity along the cheek area with jowl formation. There are some patients that have laxity only in the neck area and have minimal to no jowl laxity, and they're wonderful candidates for a neck lift. The difference between the two is not much in terms of recovery, but the facelift involves more incisions that go along the ear in the front, but they're still hidden. So how long does all this last? I think the most important thing is genetics, and basically those people that have been blessed with really good skin elasticity and nice thick skin, I think generally have a longer lasting result from a neck lift. The other thing is in terms of previous history of habits, sun exposure, smoking. I think both of those things are very bad for you and tend to make your skin less optimal for surgery. I always ask people to stop smoking before surgery because not only is it healthier for you, I think it makes your results last longer. Smoking is very bad in terms of the oxygen delivery to the skin. The other thing is in terms of sun exposure, you can't undo what's been done, but when we do a neck lift, we're removing that poor elasticity skin, and hopefully we're retaining better skin. But if you go on to continue with some sun exposure, that is not the best thing for you. And lastly, we'd like to have people maintain a good body weight after a facial procedure. The reason being that if you go on to lose too much weight, whether it be, let's say, 20, 30 pounds, you're obviously going to form extra skin there, and you'll feel that you want to have that tighter. Overall, I think that the best answer is that I think that the longevity of these procedures really depends upon the person, but we like to give a general rule of somewhere of about 10 years or so. Whole feet will last longer. Touch-ups generally are not that involved because the most important thing is the first time. So when we perform specifically only a neck lift, generally we are removing excess neck skin, tightening muscles of the neck, getting rid of that turkey gobbler, so hopefully those things don't need to be repeated again in the future. Generally, it's just extra skin that's created. So the best way is get an opinion, go see a board-certified plastic surgeon. The most important decision you'll make is the surgeon that performs your surgery. Thank you.